Here we have the Jame Town support group, and this morning we are meeting in the Freeman Methodist Church. This is the first Methodist church that was built in Accra. So this is a support group of women who have suffered gender-based violence from Jame Town. And this support group was established in 2000. And we picked 10 women initially. So we put them through training at the Usher Polyclinic, which is in Jame Town here. Then we help them to do detergents, liquid soap as you see, Parazone and Dettol. We also gave them logistics to do this work. And people went on their own to do the work. Like Marikisu, she started producing the liquid soap, Dettol and Parazone so that she can sell for herself. Now she can boast of taking care of her family. She's a single parent, a SGBV survivor. She can take care of herself and their children without relying on anyone except. And she's so grateful to INERELA Ghana for bringing them together. Again, these are the members of the community or the SGBV survivors who benefited from our food parcels. Twice they received food parcels from INERELA Ghana.
INERELA Ghana, I'm school fees for paying. She be an ember problem, the Johnny may no can say after wash can be. You will be an business say you will not make a Jame Town.
Her name is Beneficiaries. She is actually a survivor. Her previous husband brought in another lady, and that separated the marriage. So she went to the man asking for school fees for the children, and the man actually slapped her, and that gave her a cut in the face. So she had to go to the hospital. And then whilst going for the treatment, somebody advised her to report it to Gwaju. And Gwaju is the now DOVSU, that is the Domestic Violence and Victim Support Unit of the Ghana Police Service, where victims of domestic violence report their cases to and seek intervention. So that was where INERELA Ghana was introduced to her, and then she came into contact with Mercy Hayford Mrs., who happens to be the coordinator of INERELA Plus Ghana. So in her interactions, she was giving counseling, and after the counseling, she was asked that there will be a training for such victims or such survivors. So she also voluntarily offered to be part of it, which she did. And they were taken through soap making, detergent making, and then Dettol. So after the training, even before the support system came to her, she managed to gather some money on her own to start something with the training that she had acquired. She didn't sit idle. Even though the money came in very late, not too late, but then 6 months after their training, within that 6 months, on her own, she had been able to start something, and she started selling just to get some income to support the children and herself. Now, she is confidently saying that she can be on her feet. She's now on her feet, providing for the children and herself without depending on any man. Now, she doesn't even go to the father of the children to ask for their upkeep money. Because of what she's into now, she's getting a lot of customers, and her items are being bought to gain some money to take care of herself and then the children. And she wants to take this opportunity to commend INERELA Ghana for the intervention. Without it, they wouldn't have been able to survive. She would be wondering, depending on people for survival. But now she's now well equipped in terms of skills, and that is what she's depending on now. So she's asking that INERELA, the project should be intensified so that a number of women in her situation will also be supported.